Hi again. As promised, this is my second installment, which I am calling Surgery and Recovery. Before I get into it, I guess I wanted to spend a bit of time to thank you so very much for your feedback. I heard from people from all over, and even more than that, the fact that many of you reached out to my daughters and my sisters and my husband, that meant the world to all of us because it gave my kids just an extra source of support. And it's amazing how many people reached out with their own stories. And it makes you feel less alone. And it's funny how they can fill in blanks of knowledge you don't have. So again, it kind of reaffirmed my notion of doing this. And maybe once we look at what everyone has to offer, it does paint a good solid picture and help us all. So again, with that, I'll dive into the next element, which is the surgery. So I want to talk a little bit about what happens on the day of the surgery. First of all, leading up to it, the day after, or the day of, and then recovery. So leading up to it, you'll get information, usually in writing. I had a little booklet, as I mentioned before, that came home with me, and it explained a lot of this. There was also a phone call, though, with a physiotherapist. They really want to focus on post-surgical care, so there's a lot of information that you're provided with, which is quite helpful. I actually happened to be on a Zoom call as well, which was with other women who were going to be undergoing a similar procedure, in some cases a mastectomy, in some cases reconstruction, so different things. But we all were given the same messaging when it came to post-surgical care. So a few things, just small details, which do make sense but surprised me a little bit. One of the first things they tell you is that you have to go in without nail polish and on your toes or your fingers, and you can't have artificial nails. And I was joking with my family, and I said that was almost a deal breaker for me because I have terrible nails and I always have artificial nails on. So, but obviously they came off, and as did my toenail polish. From what I understand, it's about oxygenation, and they want to be able to see the beds of your nails, so that makes sense. The other couple of things are, no eating and no drinking past a certain time. But interestingly, they do recommend that you drink a clear, sugary fluid before, as you're turning in. So the last thing you drink before your sort of cutoff time. And they talk about cranberry juice and 7-Up. Can't have any pulp in it, so it can't be orange juice, or anything, like I say, that's got full sugar in it, so you don't have anything diet. So that supposedly helps with your recovery. And then they tell you to pick up an antiseptic sponge from one of the drugstores, and it's basically in a little silver package. It's about that size, and it's the same concept as the surgeons use when they scrub in for a procedure. So they want to make sure that you're very, very clean. That you do it the night of, and you do it the morning of, or the night before and the morning of the surgery, again to make sure there's no chance, or minimizes the chance of any kind of infection. So I thought that was quite interesting. So fast forward to the morning of the surgery. I had to be there quite early. I'm sure they staggered the surgeries throughout the day, but I had to be there quite early. Once you're checked in, the first thing I had to do was go to nuclear medicine, and they injected a radioactive agent into me. And the notion, or the reason behind that, is that they want to be able to track where fluid drains first under your arm, which is the first node called the sentinel node. And the reason for that is, as part and parcel of the breast cancer surgery, and in my case the lumpectomy, they take out the sentinel nodes, 1 to 4 nodes. In my case, they took out 3. Excuse me. And they do that because they want to make sure they can track whether the cancer is spread. So when they do a pathology of the nodes, and you'll get the results on Thursday when I see my surgeon. So you get that radioactive agent, you go into what's like an MRI machine, and they track the fluid to make sure they can see it. And then once that's done, I had a fine wire installed, and that's basically a marker so that they can see. So they take the scans, and they see where the mass is, and they put the wire in right close to it as a marker for the surgeon. It's very clear they do what they can to make it as expeditious for the surgeon. And it also benefits the patient because you're only under for a limited amount of time this way. So 50 minutes is the procedure beginning to end once you're on the table. And I think a lot of it has to do with the pre-work that's done ahead before going into surgery, which I think is great. So at that point in time, you end up in the recovery room once they're done. Now, before the surgery, the surgeon comes in, makes her markings under the arm and on the breast. The anesthesiologist comes in, and the OR nurse comes in, and they all want to make sure they have the right patient, date of birth, what breast is being done, and so on. They don't take any chances, which is awesome. The surgery is almost exactly the 50 minutes, and you end up in the recovery room. And then after that, you're in the surgical day ward, and then you're ready for discharge. And they'll call whoever the person is that's going to pick you up. My case was my husband, and then he picks you up. Now, it's important. I don't think anybody would be surprised about this. You end up being what they consider to be legally impaired right after the surgery. Can't sign documents, can't operate machinery, you can't drive yourself. And so for 24 hours, you're pretty much asked to go home and kind of start to recover. So you're really pretty sleepy at that point. Now, the thing about the surgery, and they tell you this ahead of time, they prepare you, is you may have a drain installed. And it sounds like it happens more often than not. Now, the drain is a long tube, and at the end of it is a shape looks like that, and it's clear, hard plastic, soft plastic, but durable plastic. So there's a clear drain that leads to this bulb. And the drain, the objective of it is to draw out the fluid and send it down the drain and out of your body so that it won't get infected. Inside the body is a piece that looks about that long, and it's white and similar to the shape of a pipe cleaner, but it's a sponge. And it basically, as you would think, absorbs the moisture, sends it down the tube, and it's expelled into the little bulb. With that bulb, you have to drain it twice a day, in the morning and in the evening. And once it's less than 24 milliliters of accumulation per day for 2 days in a row, then you have it removed. Now, it is sutured in, so you have to go back to the hospital and they remove it. They cut the sutures and remove it. And it's a very quick process, so that wasn't too bad. You also wake up with a binder, a breast binder. Now, I'm going to do a bit of show and tell here. Everyone's is probably different, but this is what mine looked like. Literally, it looks like a pink tube top, and then it's got Velcro in the front, and it keeps everything in place. So it's a very helpful tool to have. And you basically keep that on until the drain comes out. For me, it took 4 days before the drain was ready to come out. It just keeps everything very intact, all the tubing and so on, and you feel more comfortable, honestly, more supported. But it is a little bit tight, so it is nice when it comes off. The one thing that I should mention, my sister discovered this. I think it was through Amazon. I don't know who told her about it, but it's a smock, and it buttons up the front. It's a little bit longer than a normal t-shirt. It's more the length of it, like a tunic. It's kind of a heavy cotton, but what's really interesting about it is there's a pocket on either side inside the shirt where the tube and the drain can sit, the bulb can sit, so it's very discreet. So it just feels, you feel more comfortable because everything's hidden if you have to be out of the house for whatever reason. So I highly encourage you to look into that. It was a game changer for me. I found it very, very handy to have. I think they come in packs of 2 from Amazon, as I said. So the going home process, you basically have an appointment to see your surgeon. In my case, it was 2 weeks after my surgery. And at that appointment, I'll find out whether there was any issue with the lymph nodes or whether they came out clean. And then my treatment options up from there will be discussed as well. In terms of recovery, the biggest thing is no lifting. You can't have a bath, you can't have a shower until the drain's removed. So you have to be mindful of that. Lifting your arm above sort of midline is difficult and sore. And because of the location of the incision, it's kind of right under your arm where, when you move it, you can kind of feel it. So it's very important to try and not use that arm as much as possible and certainly not lift anything heavy. I have a wonderful little grandson who's just about 2. And that was the hardest thing for me, and has been, continues to be the hardest thing, because I can't lift him. He looks at me and he goes up, and I can't do it. Luckily, his mom or his dad or my husband will lift him, and it's all fine. But there are things like that you just take for granted, or lifting groceries, or vacuuming. You can't vacuum. That's one thing they really stress. So that's kind of the process. I found for me, I feel quite good. Thursday will be 2 weeks, so today's Monday. This Thursday will be 2 weeks since my surgery. I feel really good. I feel like much more mobile. I have more energy. They really want to encourage you to walk because they want to avoid any chance of pneumonia or blood clots. They encourage you to walk. They encourage you to keep your arm elevated because the other potential complication can be lymphedema, which is a swelling of the arm in the top area here. And you can minimize or mitigate the risk by having your arm elevated 45 minutes a day. So when you sleep is a good time, or if you're on the couch, just elevate your arm because they don't want that arm and area to swell. They say they don't exactly know why it does happen in some people and not others, but they also give you a really interesting kit. And it's basically a tape measure that tightens around your arm in different spots, 5 different spots on your arm. And you measure your right against your left and your left against what your first measurement was when you came out of the hospital, and then they can tell. And if you are suffering from any kind of swelling, physiotherapy will see you right away, and they'll begin a course of treatment to try and manage it. So that's really really good to know. So far, touch wood, I've been well, but it's good to know that exists. The last thing I want to talk about before I end it is the recovery part of things. I did talk about a little bit what you can't do, but I want to talk about the emotional side of things. I met a lady in the hospital who was in the same waiting room. She was having surgery after mine, and you could tell she was quite concerned. And so as we were talking, I said, "Oh, you seem concerned." And she said, "Yeah, my son's graduating. He's 18. He's graduating from high school. Congratulations." "Yeah, but I'm worried because we have this big party planned, and I think it's going to be hard for me to get all the decorations and stuff done." And I said to her, "Well, you have family, right?" And she had mentioned her family. I said, "Yeah, you have a lot." She goes, "Oh, we have a lot of family." And I said, "Well, then, why not let them help you?" So the one thing I think I've discovered over years is people want to help and people want to support you. And if you give them that opportunity to do that, it helps them too, because they don't want to see you suffer and in a bad way. And if they can do even something small to help, it helps them as well. And I said, don't get into the whole, guilt of not doing it yourself. This is something you can't control the timing, and it's really important that you put yourself first in this instance. You only get one chance to recover. And so she kind of smiled and she goes, "Yeah, my husband and my mom will help." And I said, "Yeah, let them do that. If no other time, let them do that now, because it's really going to matter the most." From a patient perspective, being a patient, I had people ask me what they could do. People want to help. They just want to help. They want to support. And I'm always, the person who says, no, it's all good. It's all fine. But my one sister who lives in Toronto took the initiative to put together a little spa package for me. Little face masks and little eye creams and, smart plugs, so I could easily, turn the lights off. And she's a techie person, so she quite likes that stuff. And just a little something to treat myself, magazines, cooking magazine, just so that if I was immobile and stuck in bed for a while, I had something to distract me, which was great. Not necessary, but so appreciated. My other sister and my sister-in-law put together 2 different meals for me. I could only have soup at the beginning, so Kim made me this beautiful split pea soup, and it was fabulous, delicious. And then they brought me what they called Jewish penicillin. It's basically chicken soup from one of the delis. Things like that, easy to heat up, easy to eat. That was very, very appreciated as well. But other than that, it's little visits, little messages. Visits, you want them short because you get tired, but just for people to reach out and tell you they're thinking about you. And, in some cases, people would send a card. It's a little gesture, but it really does make a big difference when people know that you're thinking about them and, they want to support you. So if I can say that, if you're the person who's had this surgery, let people help you, let them in. Allow yourself to take a step back, because it's okay, and everybody wants to help. And if you're the person who is the person who is trying to help someone who has had the surgery, little gestures like that count. Little things of soup, little visits, a little email message to say, "I hope you're doing well." So I hope this has been helpful. Again, it's been helpful and cathartic for me. And so I appreciate your attention more than you can possibly know. And my next video will be once I've seen the surgeon. So everyone, please wish me luck, and I hope it goes well, and I will talk to you very soon. Thank you very much. Have a great night, everybody.